This meeting is being recorded.
Okay. All right. All ready when you are.
Okay, I'm having a little computer trouble right now, so I'm on a different machine that doesn't have a video. But I think we're going to start this meeting. We want to welcome everybody here. Thank you for coming. And Reverend Wicker is going to open us with prayer.
Greetings, everyone. I am Reverend Wicker, a member of the Faith Health Caucus and the Medicare for All Health Coalition. I am glad to be here with you tonight. Let us pray. There is a wisdom writer who said, if anyone lacks wisdom, let them ask of God, and God would certainly provide. The writer also asks us to ask in faith and not to doubt. As the Faith Health Caucus, this is our aim tonight, to ask Almighty God to be with us, to work with us, to have mercy on us, and empower us in the journey for health justice in North Carolina. Creator God, we have come this far by faith, leaning on you, trusting in you, believing that with you on our side, we cannot fail. Believing also that with you on our side, we have all that we need to succeed. We ask tonight, God, that you would bless this gathering. Bless us with a special grace to understand the complexities, the nuances, the hideous injustices of a healthcare system that isn't working for most people. Bless our speaker tonight. Bless this virtual audience, that they might feel that their time tonight with us has not been spent in vain. We ask your blessings tonight, that you would provide us with the insight so we might know how to move forward and build momentum as a coalition, as a caucus, but more importantly, as people who have all been created in your wonderful image. And while we operate from an anti-oppressive framework where it appears that no one is ultimately in charge, we welcome you tonight. We invite you, Creator God. We pray that you would be our leader and our guide as we strive to make Medicare for All a reality in the lives of all U.S. residents. In the many names of God, we pray. Amen.
Recording in progress.
Thank you, Reverend Wicker. I'm having a few computer problems.
Sandy, are you also on the phone?
No, I tried to log in.
Okay.
I'm going to log out of the other machine.
Okay.
It's not working right now. So I'll just stay on this one without any video. But thank you, Reverend Wicker, for that beautiful opening. For those of us in the Christian faith, Dr. Jennifer Copeland, Reverend Dr. Jennifer Copeland of the Council of Churches, reminded us some time ago that Jesus was the original universal health care provider. And so we need to remember that as our example as we're going forth. Jennifer reminded us that Jesus did more healing than preaching. And in our society, we have really failed at healing our country. Tonight, we are honored to have Rebecca Sears with us, who, if you haven't heard her, you're in for, I hate to say a treat because she's not giving us good news, but she gives it so clearly and gives us information about what we can do as people of faith to move the healthcare on. Rebecca is a policy advocate for the Justice Center, and we really appreciate her time tonight. She gives us a message that we need to get in all of our churches. We in the Faith Health Caucus are trying to get the community, the faith community, involved in healthcare and in advocacy for healthcare. And Rebecca gives us the tools that we need to share with our faith communities. Welcome, Rebecca, and thank you.
Thank you so much, Sandy, for that totally wonderful, lovely introduction. I'm so happy to be here with everybody on this wonderful Tuesday night. Thank you so much for joining us. I am a policy advocate, a health policy advocate, like Sandy said, at the Justice Center, but I'm also a proud founding member of the North Carolina Medicare for All Coalition. And that is what we're here to talk about tonight, the need to transform our healthcare system, the one that we currently have now that puts people over profit, that leads to unnecessary death and suffering, and change it to one that will actually put people over profit, and actually save us money in the long run, address racial health disparities, and make sure that we are actually prepared for the next public health emergency. So I have a presentation. A lot of you have seen parts of it, but I've actually reworked it. So I'm hoping to give you all something a little bit new today. So hopefully it will be effective. Just wanted to start off by centering the people that have suffered or have died unnecessarily, and their families because of our healthcare system, because that's what this is all about. That is what got me into this work. My mom had breast cancer. Thankfully, she is a breast cancer survivor, but she did not have insurance. And going through that whole process with her, where she was put in collections while trying to deal with, losing her hair and chemo and losing one of her breasts, was a life-altering experience for me, and one that I wouldn't wish on anyone. And so that is what really sparked this for me. And it really just takes people like all of us on this call to speak up and to move us to a different place. Because the truth of the matter is, we never know when the opportunity for real change is going to happen. It can come in a moment, even if it seems impossible now. Like Nelson Mandela says, it always seems impossible until it is done. And so the best way to do that is to learn the facts about what's going on. So I'm going to share my screen. If I can find my PowerPoint. Okay. And I'm going to start the slideshow. Can everyone see that okay?
Yes.
Yes.
Great. Okay, so why Medicare for All single payer system, and why now? So I like to always start everything, all my presentations off with an understanding that there has been a mass misinformation campaign, a very well-funded mass misinformation campaign waged on the American people to discredit Medicare for All, a single-payer universal healthcare system. And the reason we know this for a fact is because we have an amazing whistleblower named Wendell Potter. He's the former vice president of the corporate communications of Cigna, turned whistleblower. And here's just one of his quotes. If you don't follow him, if you're on social media, really, he's an amazing person to follow. He speaks the truth now. So he says, if you're among those who believe that the US has the best healthcare system in the world, despite overwhelming evidence to the contrary, it's because my fellow spin meisters and I succeeded brilliantly at what we were paid very well to do with your premium dollars. So like I said, what is the best way to counter misinformation? Know the facts, educate yourself, share information with others. Speak and spread the truth with moral clarity and love in a way that pulls people in and meets people where they are at. And I wanted to share this wonderful picture from one of the Moral Mondays about a year or so ago, because it's going to take all of us to do this. So our current system, where are we at right now? Expensive, inefficient, unsustainable, and not working for most of us. And of course, I haven't pulled this quote out in a while, but this is actually the quote as it was supposedly delivered. We don't usually see the whole thing, but Dr. King on March 26, 1966, he was delivering a speech to the Medical Committee for Human Rights. And he said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane because it often results in physical death. And that's what I was talking about before. This is causing our healthcare system, our for-profit healthcare system is causing unnecessary suffering and death. So even before the coronavirus pandemic, we were experiencing a healthcare crisis, and this just really highlighted the need to create a universal system with no barriers to care. And in fact, just this week, a report came out, findings published in Proceedings of the National Academy of Sciences, found that from the pandemic's beginning until mid-March 2020, universal healthcare could have saved more than 338,000 lives. It could have also saved $105.6 billion in healthcare costs, on top of the estimated $438 billion that could be saved in a non-pandemic year. So we are not doing healthcare in a way that will save people's lives or save us money. The slides will be available to you afterwards, and they have live links in them, so you can go check that report out if you would like. This is also brand spanking new. The US healthcare system is the most expensive in the developed world. Shockingly, we are now up to $12,530 per person in the country for healthcare, for health coverage, not even healthcare. That's just what we're spending. And on average, other wealthy countries spend about half as much as we do, and they get better health outcomes, as we'll see in a second. Yet millions of our people are without adequate health coverage. We still have, about 87 million, and that was before COVID, who are either uninsured or underinsured. Underinsured means that you have a high deductible plan and really, or something like that, you can't afford the out-of-pocket costs. So even though you have insurance, you can't really use it. More people with health insurance were underinsured than in 2010, with the highest increases of employer-based plans. We'll talk a little bit more about that. So more underinsured people who have employer-based plans. Also, the marketplace plans are really shifting to these high deductible plans as well, leaving people inadequately insured. A 2021 Commonwealth study found that the US healthcare system ranked last amongst 11 high-income countries. We also have the highest percentage of our GDP on healthcare. Just new now, 19.7% of our GDP is what we spend on healthcare costs. This is not sustainable, everyone. This is not sustainable. And we are getting a terrible return on our healthcare dollar investment. So this is a healthcare system performance compared to spending. As you can see, we are the outlier there. The rest of our peer nations are spending way less than we are, and yet they're getting much better results than we are. And this is why the Commonwealth report found that 4 features distinguish the top performing countries. Number 1, they provide for universal health coverage and remove cost barriers to care. They invest in primary care systems. They reduce administrative burdens that divert time, effort, and spending from health improvement efforts. And they invest in social services, so a social safety net, especially for children and working age adults. Sadly, all things that the United States has chosen not to do. So want to give you some facts about the US healthcare system. Again, how do we battle misinformation? With facts. Despite spending almost twice what other countries spend, we have over 90 million people who aren't adequately insured, and our outcomes are worse. We have lower life expectancies. We have worse maternal death rates. We have higher infant mortality rates. It is a disgrace what's happening in our country in terms of these health outcomes. And our life expectancy has declined 4 out of the last 5 years. So just absolutely a disgrace for the richest country in the world. And of course, that is only amplified when we're talking about putting race into the mix. So we're experiencing catastrophic and unacceptable racial health inequities. Just absolutely, just the maternal mortality rate alone, African-American women are more than 3 times as likely to die than their white counterparts during pregnancy or the following year. Same with infant mortality rates, much higher amongst Black children, Black babies, in things like high blood pressure, diabetes, stroke, unfortunately, all things that are disproportionately impacting Black folks more than white folks. And part of that is straight up racism, for sure, a big, big part of that. And of course, as a consequence of this, during the COVID-19 pandemic, there has been, a lot of disproportionately impacting Black and brown folks who have been suffering the most from COVID. So if you can you please mute? I'm sorry, I got a little distracted there. That would be great because I'm also running the tech stuff and I can't keep up with all of that. I really appreciate it. Thank you. So wanted to give you some more facts. So about 155 million people have employer-based insurance in the US. So what does that mean? It gives employers a lot of control over their employees' healthcare. Many employer-based plans, like I mentioned before, have shifted to high deductible plans. It creates job lock and stifles entrepreneurship. Job lock is basically people staying in jobs they hate because they or someone in their family needs the health coverage. It also stifles entrepreneurship. We say we love, entrepreneurship, small businesses in this country, and yet the system that we have right now actually makes it very difficult to start your own business, especially if you have a pre-existing health problem. So, and of course, one we saw during COVID, how reliable and effective is employer-based health insurance when millions can be laid off during a public health crisis. Also, it keeps union members from being able to effectively bargain for better wages and working conditions, because unfortunately they are stuck using most of the oxygen in their bargaining to bargain for good health coverage. And as we've seen, employer-based coverage is actually still getting worse and worse. I mean, I can just talk from my perspective. We have a union shop. I have coverage through my employer, and I still had to pay several $100s out of pocket to get trigger injections in my neck for my migraine headaches. Specialists are $50 a pop. That's not affordable for a lot of people. So we have a GoFundMe healthcare system. Everyone knows this. Our for-profit system is forcing people to beg strangers for money to cover necessary medical care. This just came out, if you haven't seen it, and I'll put the link in the chat later, but a recent Kaiser Health News report just last week found that 100 million people in America are saddled with healthcare debt. 100 million, that's 1/3 of people in this country. And this graph right here is showing that it hits even people with high incomes and people who have insurance. And of course, we're the only developed country that allows its citizens to go bankrupt because they got sick or had an accident. And again, many of these folks who are filing for bankruptcy are insured. And 2/3 of people who file for bankruptcy cite medical issues as a key factor. Unfortunately, the onset of the Affordable Care Act has not improved things in that. And of course, a huge part of our messed up healthcare system is Big Pharma is ripping us off. We pay more for the top 20 drugs than the rest of the world combined. And in some cases, we pay 10 times or more what other people pay in other countries for, basic drugs like insulin. Where we're forcing people to ration their insulin and other life-saving medications, which is just absolutely unacceptable. So how did we get here? So we got here because back in the 1960s and 70s, we decided that we were going to have a private for-profit healthcare system. So we commodified US healthcare. At the same time, Canada chose to do a Medicare for all system, and their costs have really leveled out, whereas our costs continue to skyrocket to the point, again, I just want to say 19.7% of our gross domestic product is now on healthcare, and we have terrible health outcomes and many, many millions of people who are uninsured or underinsured. We actually pay private insurers to, so private insurance increase their profits by denying us care, and they redirect billions of our dollars away from healthcare. So we are paying these private insurers to restrict our access to care and stand in the way of the provider and the patient making decisions based on health. Why are we allowing this? Why are we allowing for-profit middlemen to come between us and our doctors? It doesn't make any sense at all. And in fact, the death panels that people used to talk about when we were talking about the ACA, the real death panels are actually the insurance companies and all these other interests who are denying us doctor-prescribed care so they can make profits. And that is the truth of the matter. And, later on, I'm going to talk a little bit about taking action steps, but I just want to put a pin on this because I think we have to start going on the offense as people who support a single payer universal healthcare system. And we have to ask people, including people that are running for office, candidates, why are you supporting a privatized corporate healthcare system that puts profits over people and has an incentive to deny people care so they can make more profits? We have to go on the offense instead of always having to defend what we want, which is actually a much smarter way to do healthcare. Not going to go into this very much, but we also unfortunately have the privatization of Medicare and actually, sadly, Medicaid as well. So Medicare Advantage program plans are actually privatization of Medicare. They seem good on paper. You see all those commercials all the time. You can get dental and vision and, and there's out-of-pocket caps, but in fact, they are actually worse. And on the back end, they are actually costing us more because overhead for traditional Medicare is about 1 to 3%, and it skyrockets for Medicare Advantage plans. And on top of that, they have now come up with a new scheme, these ACO REACH programs, which are private equity firms bribing doctors to move their patients into sort of private, for-profit plans without even asking their permission. So we're actually going totally in the wrong direction. And in North Carolina, Medicaid has shifted to a managed care system. So Medicaid as well has been privatized in North Carolina and in like 33 other states across the country. What does that mean? That means that private insurers are profiting from public dollars like never before. So over a period of 6 years, United Health, Anthem, Aetna, Cigna, and Humana, so the top 5 for-profit insurance companies, more than doubled their revenue from Medicare and Medicaid. 59% of their total revenue comes from Medicare and Medicaid. And this was back in 2017. I tried to find updated numbers, but they haven't done this report again. But you could just imagine that it is more than that now, especially with more states privatizing Medicaid and more of these advantage plans being shoved down people's throats constantly. So how can we save money? One surefire way is to take the profit motive out of healthcare, which will lower costs for everyone and help us pay for it. The health insurance CEOs are making ridiculous amounts of money. During the pandemic, health insurers reported giant profits. Okay, meanwhile, people couldn't afford to get healthcare themselves. And these folks are making giant profits. But the positive thing is most people on this call know there's actually a solution out there, a universal single payer system, also called Improved Medicare for All. It is a sustainable and fiscally responsible way to pay for healthcare. And it makes so much more sense than what we are currently doing. So Improved Medicare for All is so simple. So right now we have a crazy multi-payer system, chaotic system that is filled with bureaucratic inefficiencies and waste, and private companies are making decisions about our healthcare based on their bottom line and not medical necessity. So you hear single payer. What does that mean? Single payer simply means that there's one entity responsible for paying our medical bills, not for making decisions about our medical care, but for paying our medical bills. That means important decisions are left up between the patient and their doctor, and profit doesn't come into it anymore. But one of the best parts, once enrolled, you never have to choose a health plan again. I don't know about the rest of you, but when I hear open enrollment or market, it's time to pick a marketplace plan. It's just super stressful because it's so confusing. And can I tell you, I've been doing health policy advocacy for a little over 3.5 years. And every day I am continuously amazed, and not in a good way, by how utterly complicated and overly complicated and complex our system is, and totally unnecessarily so. So unnecessary. It could just be so much easier, like every other developed country has figured out. So what are we talking about with improved Medicare for all? So most of you know there has been a Medicare for all bill in the US House that has 122 co-sponsors, and that includes the main co-sponsor, which is Representative Pramila Jayapal. That's HR 1976. But just last month, S4204, the Medicare for All Act of 2022 was introduced in the US Senate, and it has 14 co-sponsors. And so what we're talking about is it covers all US residents from birth to death. It eliminates out-of-pocket costs, so no more premiums, co-pays, deductibles. It expands coverage to include dental, mental health, hearing aids, vision, prescription drugs, home health care, long-term care. There's cost control measures there, like global budgeting and negotiating prices for drugs and medical devices. There's substantial investment into medically underserved areas overseen by the Office of Health Equity, and it ends drug patents if the companies price gouge. And that's just sort of a very quick overview. And how's it paid for? It's paid for with progressive taxation. So yes, some people's taxes might go up, but 95% of families are going to end up paying far less than what they're paying now, because even if, say, your taxes go up $2,000, you won't be paying that $10,000 out of pocket that you might have been paying. So you're actually saving $8,000. So that's sort of how it works. Progressive taxation is the way that we would pay for this. And again, we're already paying double what other countries are, and our system is not covering people and has terrible health outcomes. So another fact, what we're talking about, in a single payer universal Medicare for all system, providers, hospitals, and clinics remain private. Now we can argue about that at another time, that we should go towards something that's more like a national health service, like what England has, but that's not what we're talking about right now with improved Medicare for all. These private entities send the bill directly to the government, not you. There are no co-pays, deductibles, premiums, nor confusing networks. You choose your medical provider regardless of what hospital they work with. Healthcare will become a public good and will be free at the point of service, like the fire department, public libraries, and public schools. It's healthcare without a bill. Can we even imagine it? Most, like I said, other countries, you go to the doctor, you get surgeries, you don't have to take out your wallet. I really wonder if it's something that Americans can actually even dream, like imagine, because it's so foreign to us. So facts about the healthcare, US healthcare system: 100% of nonpartisan studies found that this system control costs and will cover everyone. And a couple of years back, even a Koch brother funded Mercatus study found that single payer saves money while covering everyone's medical needs. And as we know, Koch brothers, not fans of Medicare for all. So just gonna, go back. Just very quickly, a study from February 15, 2020 found that a single payer universal healthcare system would lead to 13% savings, about $450 billion annually. It could be funded with less financial outlay than it is incurred with what we're all paying now. It would provide the greatest relief to lower income households, and it would potentially save more than 68,000 lives a year. And the other very exciting thing that happened this year is the Congressional Budget Office, which is the governmental agency that sort of scores bills and finds out what financial impact that they will have. And they are certainly not in any way considered progressive. they came out with a new report that said scrapping corporate healthcare and creating a government-sponsored medical system would boost the economy, help workers, and increase longevity. Households' health insurance premiums would be eliminated, and their out-of-pocket healthcare costs would decline. Administrative expenses in the health sector would decline, freeing up productive resources for other sectors, and ultimately increasing economy-wide productivity. Longevity and labor productivity would increase because people's health outcomes would be improved. If we invested in preventative care and making sure every person had a primary care physician, it's like in the end, we'd have less emergency room visits, and people would be able to catch, disease and illness at the front end where it costs much less to treat, and you have much better outcomes for survival. So I'm sure you've heard a lot of people are talking about a public option, especially politicians or candidates that want to say they're willing to do something to help with our healthcare crisis. But I wanted to just spend a second here to talk about why a public option is not the answer to our healthcare problem. It will not guarantee coverage for all people. It will not eliminate copays and deductibles. It will not cover all necessary care. It will not take away all the networks. It will not control costs. It would still be just another payer in our bureaucratic, inefficient, multi-payer system. So, and really the cost savings, so much of the cost savings come from creating a single payer. And so a public option will not in any way fix that. So the other piece is passing a public option would require a huge amount of political capital for a return that wouldn't fix the problem. So how about we use our political capital to fight for what actually is the problem? Voters support single-payer healthcare. Exit polls in the North Carolina primary showed 55% support. And despite what we've heard, again, this misinformation, Medicare for All did not sink Democrats in 2020. So there are certain things, if we're talking to candidates and they're not at the point where they want to support Medicare for All single-payer system yet, of course, that's the end goal. But I wanted to just put up here for people to be thinking about other things that we can be asking for their support, because we don't want to ask them to support a public option for the reasons I just told you. But there are things that they can support right now that actually will lead us to a single payer system. Lowering the Medicare age to 55 or lower, allow Medicare to negotiate drug prices, roll back Medicare Advantage plans and these DCE, the ACO REACH programs that I mentioned earlier, add dental, hearing, and vision to services covered by Medicare, and place a cap on out-of-pocket costs for Medicare. So these are things we can talk to people running for office, our congressional candidates right now about supporting that will actually lead us on the road to Medicare for all. So how can we do this? We can build power with the North Carolina Medicare for All Coalition. We have 45 diverse intersectional organizational partners working together for change. There is power in numbers, everyone. We have a unique opportunity through the power of our coalition to put pressure on our current and future lawmakers to support Medicare for All. And we can change the hearts and minds of people across North Carolina. And I just wanted to point out, over this past weekend, due to work that so many people have done for years, the North Carolina Democratic Party actually put Medicare for All into their official platform, Democratic platform. This was, people didn't think that this was going to happen, that it was even possible. And yet we did, we moved it forward. And now officially the North Carolina State Democratic Party supports single payer universal healthcare. And that's the language that's in there. And so we can change people's hearts and minds, and advocacy can work. Unfortunately, it's usually a marathon and not a sprint. So how else can we take action? You could join the Medicare for All Coalition and the Faith Health Caucus. I am going to put links in the chat once I'm done. You can let your voice be heard. Start conversations with your friends, family, and strangers about single payer universal health care. Again, meet them where they're at. Use ways that can pull people in rather than divide. Consider creating a sign-on letter for people of faith that could be sent to candidates running for office. I think that would be a really great thing to do. Making the moral argument, the faith-based argument for a universal healthcare system. You can send postcards asking candidates to support Medicare for All, and we have a sign up for that, which I'll put in the chat. Or you can sign up to get trainings on giving your own Medicare for All presentation. Are you interested in giving a presentation like me right here? Then, you know, please, I'll put a interest forum link in the chat as well. I'd be happy to do a training on this presentation or whatever kind of presentation that you want to do. So join us in this fight for healthcare justice. You can email this email to join our listserv, and and you can check out our educational resources. I wanted to go, I have some other things, but I'm just gonna, these are just sort of facts, but I wanted to just do this last piece. Why hasn't Congress fixed this? We cannot ignore the elephant in the room. Unfortunately, our politicians, many of the people who are running our government have taken money from special interests and have and that is why things are not moving forward. Because let me tell you, I have done the research. The research is on our side, everyone. A single payer universal healthcare system will cover everyone, will actually control out of control skyrocketing healthcare costs. It will begin to address racial health disparities, and it will help prepare us for the next public health crisis. And yet we keep hearing how it can't be done, it can't be done, it can't be done. The only reason it can't be done is because unfortunately our politicians are corrupt. There's an article out about how, you know, basically President Biden is hiking the premiums for Medicare. They're at $170 a month right now for people, for people on a fixed income. That is just an insane amount of money. And they're pushing more and more of these Medicare Advantage plans. And why is that? Take a look. He raised almost $47 million in personal donations from healthcare executives over the course of the 2020 cycle. That is not even including donations coming in through super PACs, other political action committees, and things like that. So we do have a problem with money in politics. We definitely have to deal with that as well. But I think that is the reason that we have to use our people power to influence the folks that are running for office right now with our facts and overwhelm them with our people power numbers so that they're forced to support what we know is the right thing. So I will stop there and take questions from folks if you have them. Sam, question?
Oh, thank you. I got two real quick questions. The exit polling that you mentioned, was that all voters or was that Democratic voters?
Nope, it was, sorry, go ahead.
No, go ahead if you want to answer that one.
Yeah, that was in the Democratic primary, but that also in North Carolina includes unaffiliated voters.
Okay. And are you all talking to state level candidates or asking state level candidates about their position on deprivatizing Medicaid?
No, we are not doing that yet. That is a little bit more complicated for me personally, because this is what I do for a living, and I'm trying to push Medicaid expansion, and it gets complicated. But I know a lot of folks in the Medicare for All Coalition are really focused on trying to dismantle this Medicare Advantage and really bring attention to these DCEs, or these ACO REACH programs that are these private equity firm programs. I will tell you this, like, it was my dream to try and, like, I was like, oh, if the Democrats take over, 2 years ago, then we can expand Medicaid, no problem. And then we can actually start trying to reverse this managed care system. Unfortunately, that did not happen, but it's definitely on my list of things that I want to do. What we're really focusing on right now is trying to be watchdogs and give patients the a voice, help amplify their voice if these managed care plans are not delivering what they're supposed to be delivering.
Okay, and you just made me think of one other thing, then I'll stop and let someone else go. Do states have the ability to lower the Medicare eligibility age on their own, get a waiver for that?
Medicare for all, Medicare is a federal program. Medicaid is jointly run by the federal government and the state government.
Okay.
Thanks, Sam. Other questions?
Hi, this is Elaine Hart Brothers. Do you know if other countries have racial health disparities, those that do have government plans, Canada, wherever, and the percent of people of color may be small, but has someone studied racial health disparities when there is universal health care?
Great question. So I am going to point to another program that the wonderful Faith Health Caucus put on, where we talked about sort of healthcare in Cuba and universal healthcare in Cuba and Canada. And what the folks on that call said was, that is not data that's actually looked at. So it is possible, but it's also possible that that's not the case. But they actually don't look at racial demographics when they're looking at those, at that. But the thing is, if it's a universal system, anyone can go and not have to worry about money.
Yeah, but attitudes in Cuba, racial color discrimination, and even segments of access to care still could exist, like you say. We knew that from the Institute of Medicine a long time ago. Now it's even more with studies that it's not just having insurance.
Oh,
it's a social complex situation with racial disparities. Okay, I just wondered. Okay, one more question.
No, that's a great point. Sorry, go ahead.
All right, another totally different thing. If we had Medicaid expansion and a public option with Affordable Care Act that we know is not affordable, but who else are we leaving out? If we could lower the age for Medicare, have Medicaid expansion, and have a public option, then who are we leaving out that's not going to be covered with healthcare, with insurance?
Well, we would be leaving out undocumented folks, which is a big issue. But the bigger issue is, again, the Affordable Care Act leaves people underinsured. Medicaid has very bad reimbursement rates, and so what I was going to say is this idea of a single payer universal healthcare system, Medicare for all, it's just a foundation. Our healthcare system has many problems, in racism being one of the absolute biggest. But if we do a single payer universal healthcare system, that lays a very strong foundation on which we can build to improve these other areas, including trying to reckon with our racist our racist systems in this country.
Thanks. Okay.
Margie?
Can you hear me now?
Yeah.
There's a question in the chat that somebody's asking for more information about how people are put into these ACO reaches without their consent. And I'd just like to explain that a bit. The ACO reaches are networks. They're accountable care organizations, and physicians will join these groups as participating practitioners in the ACO REACH. And any person who has their primary care doctor in one of these REACH organizations is aligned to the ACO REACH based on who their primary care doctor is. So it's the primary care doctor that chooses the ACO REACH organization. And the only way out of being aligned to one of these ACO REACH organizations is to find a doctor that's not part of an ACO REACH and change your doctor to that, to someone that's not part of this system, which may be difficult to do.
Thanks for that, Margie. It seems almost unbelievable that this is a real thing that's happening, but not really, because like I mentioned, we have special interests who are running our government. Other questions?
Emily looks like she's raising her hand. Just start talking.
Okay. Who is the best person to write in our state to ask for this Medicaid expansion? If we, write a letter, would it be the committee, the health committee? Or would it be our particular whom we are constituent of, and who that is and how we would find that? Or just the chairs of the committee? Who would be the best people?
So you're talking about Medicaid expansion right now.
Uh-huh.
Okay, so Medicaid expansion, especially if you live in a North Carolina House district that has a Republican representative, the best thing you can do is call them right now and tell them that you want them to support Medicaid expansion. It was passed in a bill that included other provisions. It was like a health omnibus bill on June, at the beginning of the month, by the North Carolina Senate. The chances are that bill is not going to move forward, but what is more likely to happen, and it's actually, I'm optimistic is going to happen, is that Medicaid expansion is going to be put in the budget, and the budget should actually be coming out in the next day or two. So we should actually know, within the next day or two, if it is somehow going to be put into the budget. But your House representative should hear from you, especially if they are Republican. I know that Christine from Down Home is on the call. She is doing advocacy training and bringing people to go meet with their representatives or setting up Zoom meetings with them. I mean, if that's something that you can do, absolutely, really great. Now, I wish I could say, even though that Tim Moore is the Speaker of the House, so he should be willing to hear from anyone. Unfortunately, that's not the case. So I actually think in that case, it might be counterproductive to do it. But yes, the best thing you can do is call your House rep, especially if they're Republican, and B, try and write a letter to the editor for your local paper just to get the word out to the people in your area that this is something that really needs to happen in North Carolina. It's the quickest way we can get 600,000 people covered.
So we would want to know what that bill is that it's attached to.
I would just say Medicaid expansion.
Okay.
You don't need to mention a bill number, nothing. Just focus on Medicaid expansion. In that omnibus bill that I was talking about, there are other provisions in there which are actually, Medicaid expansion was the least controversial thing in that bill, which is kind of mind blowing after almost 10 years of fighting for this. So we're just laser focused on saying pass Medicaid expansion, pass Medicaid expansion, pass Medicaid expansion. Yes, Christine, absolutely. Pass Medicaid expansion. Other questions?
Rebecca, I would just like to know whether or not you have heard of any groups who are challenging the pharmaceutical companies, especially those here in North Carolina, where the industry is prevalent. Because until we have Medicare for all, that's a great expense that people have to deal with. I can give you an example that my brother had a $40 prescription that went to $400 overnight. And so, of course, he could not afford that. So his doctor had to give him a different prescription, which means that people can't get the medicine that they need under such circumstances. And it's just so unfortunate. And so I'm just waiting for a real push to begin with the pharmaceutical companies.
Yeah, great question. So Build Back Better did include, for better for worse, allowing Medicare to negotiate on certain drugs, very few. It needed to be way more. We also are looking at ways to try and look at lowering prescription drugs on a state level. We're sort of planning and plotting for the long legislative session next year, because the short legislative session is hopefully going to be over in just a couple of weeks, and we're not going to be able to move on it this time. But yes, doing something about prescription drugs is a passion of mine, definitely moving forward on it. The administration, the Biden administration, has been talking about this $35 cap on co-pays for insulin, which is incredibly problematic, because the problem is not co-pays. The problem is the price of insulin overall, and putting a cap on co-pays does nothing for people that don't have insurance, and things like that. So yes, absolutely, we need to figure out ways to move forward on a state level in particular, and continue to do federal advocacy around drug price negotiations. And there are things that President Biden can do. Oops, hold on. There are things that President Biden can do right now with executive order that he's choosing not to do for whatever reason, which is really a shame, because people are really hurting, and no one should have to ration meds. It's incredibly dangerous. So much work to be done, everyone. There's definitely no lack of advocacy efforts that we need to be pushing for. But again, there's power in numbers. We have the facts and the truth on our side. The truth of the matter is, I'll just repeat it again. Our multi-payer, inefficient, bureaucratic, uber expensive system is failing us. It's causing unnecessary suffering and death. It is costing us a fortune, and we have worse health outcomes. And over 90 million people are just completely have inadequate insurance. About 32 million are just completely uninsured. And it's just, we're the richest country in the world, and we are totally not using our healthcare dollars in any kind of efficient way. We're just, I don't want to be crass. I was trying to think of a way. The money's going into a black hole. It's not actually, it's going to shareholders, to CEOs, to pharmaceutical companies, to health insurance, to hospital systems that have found a way to profit off the suffering of others. And again, I just want to reiterate, the best thing you can do right now, listen, I hate electoral politics. I wish it wasn't so important, okay? I really do. But sadly, we live in a country where policy is made through the people we elect, and that policy is what we're trying to push for. So the best thing that you can do is get your facts, go talk to people that are running for Congress right now. So on the Senate, that would be, Sherry Beasley. If you can get a meeting with Ted Budd, I don't know if he'll ever meet with you, but it's worth talking to Republicans about it as well. We want to talk with every single person about this. I would welcome the opportunity to talk to conservatives and Republicans about this and hear their concerns and explain to them why this is the fiscally responsible way to do healthcare, and that they and their families are getting screwed by our for-profit system as well. And the thing is, people know this, even if they didn't have a lot of experience with the healthcare system before COVID. So many more people have had to deal with it now, and they just realize that it is completely screwed up. And I think the other thing with the vaccine being free and the testing not anymore, but the testing having been free, it gave us a very small taste of what we can have in this country is if we had a functional healthcare system. And we don't. Yes, cost plus drugs. Nazim, is that the Mark Cuban? Yes. So thank you for reminding me. I wanted to mention that. So Mark Cuban, who is like the Shark Tank guy, he has started an online pharmacy where he is cutting out the middle person and giving so many prescription drugs for a fraction of what they cost elsewhere. I don't know if they're doing North Carolina yet. I remember reading that North Carolina they were trying to get into the North Carolina market. But yeah, this is what people are trying to do. And thank goodness that Mark Cuban is doing this, because he's changed people's lives.
Rebecca,
yeah.
I want to thank you for this excellent presentation and all the information you've given us. I think we all are indebted to you and your knowledge, and we really appreciate it. We need to take this information back to our faith communities, and you're going to post this online, right, on the Medicare for All website. Yes. So we can actually show it. We need to be showing this to Sunday school classes, to faith groups, because this is a sort of a no-brainer if we think about our faith and think about healthcare for all God's children. And so I want to thank you so much for this excellent presentation. And you give us hope that there's a better way if we can convince our politicians to listen to you.
Listen to all of us, but thank you very much, Sandy.
I think, Mary, do you want to make some announcements before we close out? Well, maybe not, but Mary does, okay.
Yes. So the next, Mary asked me to share these with the group. The next meeting is Tuesday, July 19th at 6, and will be a presentation by Donna El Hassan. She's amazing. She's a member of our coalition as well, Muslims for Social Justice. She's fantastic. So you're in for a real treat. She's an excellent presenter as well. And then the Faith Health Caucus is looking for health stories. So they can help change the hearts and minds, the state, the country, the world. And I'll put the email address in again, but the Faith Health Caucus Gmail address, and and we can work on working with you to amplify your healthcare story, because it really is about sharing it and breaking the stigma, and showing that the system is what's shameful, not individuals not being able to afford health coverage.
Thank you, Rebecca.
And I will also, just give me 1 second, and I will, hold on. I will get the link to register for the next Faith Health Caucus. And in fact, it's actually the next several Faith Health Caucus. You have the ability to register for all of them for the next event. So that's the bit.ly link for registering for the next meeting. And I'll also just put that Gmail in again for folks.
And the two screenings that you just showed us, one of them was the Muslim woman, and then there was something else. And you can't copy and paste that. And I was wondering, could we somehow get a second look at that second sheet? If you've mailed the information about the next woman that's speaking in July, that would be, yeah.
So
yeah,
it's
not that.
Yeah, so it's Donna's, and then the other one was just sharing your story, that putting a call out for stories. That was the other piece. And I'm sure Mary will send a follow-up email.
Thank you.
Sure, of course. Thank you. Thanks everyone for joining us. Really appreciate it.
Thank you so much, Rebecca, for this presentation. And I will challenge those of us in the faith community to get this information out to our friends in our churches and in our synagogues and mosques. Mary, are you going to close us with prayer? I don't know if Mary's able to get on or not.
Now, I said Reverend Barbie is here. She will close us up.
Okay.
She was here.
Yeah, I don't think she's here anymore.
Well, I'm prepared to present a prayer that I had created some time ago. I had it in front of me. All right, Reverend Wicker, do you want to, since I can't find what I had, do you want to help us out there?
Sure, I'll be happy to.
Thank you.
Thank you, Rebecca, and all those who have joined us today. I wanted to close with this thought in mind. In my organization, one of the main goal is to create or build the beloved community. And so I thought about something Dr. King, a quote from Dr. King, and he says, "Our goal is to create a beloved community, and this will require a qualitative change in our souls, as well as a quantitative change in our lives." And I think this quote is so fitting to where we are right now, because we understand the ultimate goal to be Medicare for all. But as I was reading this morning, Gandhi said that the joy is in the fight. The joy is in the process. So it's how we get to our ultimate goal is what really matters. And we get there together by working together, collaborating, getting to know each other, and loving each other with agape love. So in closing, I just want to say, God bless you and thank you for joining us tonight. Amen.
Amen. Thank you. As Reverend Wicker said, thank you for joining us tonight, and we hope to see you next month.
Bye, everyone. Thank you.
Okay.